And welcome everyone that's online. We a little rough start, but hey, the devil's real busy, but God is more powerful. So we're going to hear from our guest this evening. And as I always say, the Lord has brought us safely through another week, and we are mighty grateful.
Okay, Father in heaven, Lord, we thank you so much for allowing us to gather together this evening. We are thankful that you've provided us with a special guest who's going to give us some pertinent information on health. And we know that you want us to be in good health. So thank you so much for what you've done. And as always, we ask that your Holy Spirit will be with us this evening. In Jesus' name we pray. Amen.
And just a few scriptures about health. I'm going to start with 1 Corinthians 6:19-20. And it says, "Oh, do you not know that your body is a temple of the Holy Spirit within you, whom you have from God? You are not your own, for you are bought with a price. So glorify God in your body." And then Proverbs 17:22 tells us that a joyful heart is good medicine, but a crushed spirit dries up the bones. And then lastly, 3 John chapter 1, verse 2. "Beloved, I pray that all may go well with you and that you may be in good health as it goes well with your soul." And Cindy's going to do the introduction of our guest presenter tonight.
Okay. Today we have Dr. Antoinette Percy Lowry. She's a doctor of public health, and she's a health scientist administrator and public health emergency responder at the National Institutes of Health. Her background includes work in health behavior, cancer epidemiology, health disparities, and implementation science. At NIH, she currently leads initiatives to improve minority health and reduce health disparities. Dr. Percy Lowry is a published author in peer-reviewed journals and presents extensively at scientific conferences. So we would like to welcome you, Dr. Antoinette Lowry. You can get started.
All right, thank you. Thank you for that introduction, Cindy.
Antoinette, before you start, may we ask, are you in the Berrien Springs area? Or are you in DC, or where are you?
Yeah, I'm in Laurel, Maryland, which is outside of Washington, D.C.
Okay. Now we asked what church you attend there?
Brinklow Seventh-day Adventist Church, Emmanuel Brinklow.
Oh, that's
Okay.
Brian Woods.
Oh, Brian Woods and I, we went to Oakwood together.
Okay. Don't tell anybody that, please.
And then I have a friend there too, Gloria Banks and her husband Harvey Banks. I don't know if you know them or not.
Gloria Banks she sounds familiar.
Okay.
Okay.
My husband did a little more research about you too.
Oh,
You know you're on Google, right?
Hi. What did you find?
I saw that it's Captain Antoinette Percy Lowry,
Correct.
and that you received your doctorate of public health degree focusing on cancer epidemiology and health disparities from Morgan State University in Baltimore, Maryland, and your master of public health and public health degree with a concentration in health behavior from the School of Public Health at the University of Alabama at Birmingham.
Correct.
So your stuff is all out there.
Oh, boy.
Good stuff. Welcome again. Welcome.
Yeah.
Thanks, Cindy, for the introduction. Thank you.
Yeah.
You're welcome.
So as mentioned, I am a captain in the U.S. Surgeon General's United States Public Health Service Commission Corps, and that's where I'm involved in being a public health emergency responder. So any public health emergencies, I can get deployed for that, and COVID was a very good example of me going out in the community for vaccination uptake, or going into the nursing homes to help them lower transmission of the disease. So those are some of the examples that I've done within the last 2-3 years. So, but with that said, I do have to provide a disclosure that the presentation today reflects my own opinions, my own thoughts, and are not the words of the U.S. federal government. I'm not speaking for the U.S. federal government in this presentation. I'm speaking on the state of the Black community in the U.S. based on my knowledge and my expertise in the field for 25 plus years. So I wanted to make sure that disclaimer is known. So moving on, in light of Black History Month, I felt that it's fitting to provide this quote, a quote that we don't hear often from MLK Jr. It says, "Let us be dissatisfied until that day when nobody will shout white power, when nobody will shout Black power, but everybody will talk about God's power and human power." So to kick things off, as a reminder to some of you and maybe new to others, the World Health Organization back in 1948 defined health as a state of complete physical, mental, and social well-being, and not just merely the absence of disease or illness. And that definition still stands today. But way before that, Ellen G. White said in her writing in Christian Education that health is a blessing, a great treasure, the richest possession that humans can have. Our mental and physical power largely depends on it. Wealth, honor, and education cannot secure happiness if health is failing. And in 1905, in Ministry of Healing, she talked about the importance of lifestyle to improve health and spirituality. She said, pure air, sunlight, abstemiousness, rest, exercise, proper diet, use of water, trust in divine power, that these are true remedies. Now, building on that message from Ellen G. White, our SDA Church identified this with the acronym New Start. And as you can see, it's modeled after what Ellen G. White wrote, because for our church, health is a priority, and we are advocates to improve health, are supporting improving health. But there are some additional things to consider as well when we talk about how to improve health, especially as it pertains to Black people. And that's what I wanted to go over today. But let's first look at some common diseases across all races within the USA today. Diabetes is a common disease. Heart disease is common. It's also the #1 cause of death in the US, which is why I have that #1 there. Close to 700,000 people die of heart disease annually. Then obesity is another common disease, high blood pressure, stroke. Cancer is also common. It's the 2nd cause of death in the US. About 610,000 cancer deaths a year. And now COVID, new on the scene, is now the 3rd cause of death in the US, about 400,000 deaths a year. And it's short time, right? Interesting. Looking at statistics a little bit more, here we have heart disease. The black line represents the Black race, and the other lines represent Hispanic or white or all races combined. The good news here is you can see heart disease was falling for a while. From 2000 to 2010, the statistics were, the rates were low. And that's great. We don't hear good news a lot, right? But it was dropping, and around 2010 to now, it plateaued, relatively stable. But you can see that green line is still on top. We're still, even though the rates have dropped for all races, the Black race is still higher than everybody else. The same thing for cancer. Cancer, it was trending down. Over the last 20 to 30 years, cancer rates have dropped significantly. You see the line going down. We don't hear that a lot. People are always asking, oh, is cancer cured? Why can't they do better? But cancer was down, going all the way down. But again, there's still that big gap between the Black race and other races that you see there. I do have to add some not so good news. You will see, or the nation will hear in a few months or so, that cancer will be trending up again, after, since 30 years, cancer will be going towards increased rates because unfortunately, during COVID, folks did not get treated or followed up, or they were scared to go and see their physicians when things open up because, things were closed at one point. So all of that affected cancer rates and increasing cancer rates, so which is very sad but true. Diabetes, between 2004 and 2010, you saw a slight downward reduction in diabetes deaths. And, that was good to see, but wasn't like a big drop. And from 2008 to now, it's really not really moving much, not really showing any, in some cases, it's going up a little slightly. So again, there's a big disparity between Blacks and other races, but don't feel despair. I'm not here to give really bad news. I'm trying to, we want to understand and address why these rates are high and what we can do to improve our health. That's where I'm going with this. So let's look at the differences. Like these differences are what we call health disparities, right? And as Blacks, we experience high health disparities. Most racial and ethnic groups, your Black and brown people, as we're called, experience health disparities. And these are preventable health differences based on being socially disadvantaged due to racism, discrimination, and other unjust, unfair practices. These disparities have historical context because many of these are due to unequal distribution of social, political, economic, and environmental resources for decades, right? Black people are disproportionately impacted by higher burden of these diseases that I have listed here. So to put it in perspective, many of our differences are due to access to healthcare, health inequities, and lifestyle factors. So let's get into that a little bit. How do we eliminate or reduce health disparities? One critical way is to improve health equity. And health equity is, it's fairness in health. It's recognizing that everyone has a right to the same opportunity to achieve optimum health. It implies social justice. Health equity is valuing everyone equally and having those ongoing societal efforts to address avoidable inequalities, to address historical injustices, to address those contemporary injustices. And that means going beyond healthcare. Many times we think just access to healthcare and things will be better. But no, these are social determinants of health, are those social and economic conditions in the environment where people live, where they learn, where they play, where they worship. These social determinants of health influence health inequities, and these are avoidable. These are avoidable, which makes this, just a sad case. Factors that contribute to health disparities, again, can be medical or non-medical. So the social determinants of health are the non-medical factors that influence health, right? It's been extremely important over the last 3 years with COVID. That's when the public is recognizing, what are these things they're talking about, social determinants of health, health disparities, just how much that influences people's health by what we saw over the last 3 years. Conditions in which people live, worship, learn, play, those conditions matter, right? Access to quality health care, access to education, access food security, like you're seeing here, social justice, discrimination, poverty, employment, racism, housing, violence, all of those impact our health. And, so many of these are preventable because they're outside of our control. They're preventable by the systems that are in place, the political systems, the laws, all of that's the system that needs to break down. And that's not in our control as Black people. Factors like poverty, violence, and systemic racism may hinder someone from seeking care or participating in say, your community health activities that you may have. Because people are not interested in seeking healthcare when they can't pay their bills, they can't find food, or they can't exercise when the gym is too expensive for them, or they're not able to walk around their neighborhoods because it's unsafe, or it's violent, there are lots of crimes, or in their neighborhood there is no sidewalk, or no walkable conditions. Those are things we have to think about when we try to help folks with their health. We have to develop certain strategies for people in those situations. And many times in Black society, there are no strategies there. People just assume you should be healthy just by me telling you so. But you have to consider all of that. And then when you think about racism and discrimination, there are lower wages for Blacks, hiring practices in society, redlining in neighborhoods, police brutality, all of those things contribute to poor health. But I want to now switch gears to personal responsibility. You heard about stuff that are not so much in our control, but we need to be aware of them, right? But then what about personal responsibility, the lifestyle choices that many of us can make, because it is our responsibility as individuals to take better care of our health when we can take better care of our health. And so I want to bring attention to levels of disease prevention. There's primary prevention, secondary prevention, and tertiary prevention. Primary is taking those an action to prevent disease or illness from occurring, from developing. And secondary is screening for a disease or illness so that if we have it, it can be treated early so that the disease won't spread, or we won't cause harm, or we won't die too early, premature death. So that's what screening is all about. And then there's tertiary prevention, where if you have a disease or illness or injury, it's about managing that. Like, how do you manage that? And many times that's long-term. Some of our illnesses and diseases are long-term, but we now need to manage it to make sure that we don't worsen our illness and it doesn't impact our health. So when you think about how to prevent disease or injury, I would start with New Start, going all the way back to Ellen G. White and how the church identified this acronym, right? Nutrition, we need to make smart choices about how we eat, what we eat, when we eat. And we must exercise. Physical activity is important in our daily routine. And then, the water, sunlight, temperance, fresh air, adequate rest, trusting in God, those are all important. And then you also need to be immunized from infectious diseases. That's what we give, babies or young infants receive vaccines when they are born in their early stages from all these infectious diseases that have taken place around the world. Those are also important. Avoid tobacco products, avoid hazardous areas, wear protective gear when you are out and about, whether it's helmets or seatbelts. Avoid negative relationships, maintain those strong systems, sustain those positive relationships, which is good for mental health. So, the old adage that says that we always hear, that says an ounce of prevention is worth more than a cure is really true. So sticking to primary prevention, I wanted to mention diet and weight. Obesity epidemic is alarming. It's alarming the US. Overweight and obesity in children and adults continue to rise. It is just an upward trend. And the rates are highest in African Americans, which explains some of our health disparities. So here on this slide, people whose diets are rich in plant foods, such as fruits and vegetables, have a lower risk of getting certain cancers, right? And also it reduces the risk of diabetes and heart disease and hypertension, and it controls weight. Red meat is associated with an increased risk of certain cancers that you see here. And when I say red meat, I'm talking like beef and lamb and pork. Those are red meats. processed meat is associated with an increased risk of colorectal cancer and stomach cancer. And when I say processed meats, I'm talking about those meats that are preserved by either smoking or curing or those chemical preservatives, like hot dogs and luncheon meats. Those are some examples. Fat consumption, talk about that. High fats are linked to several cancers, heart disease as well, and other chronic diabetes. NIH has a lot of studies with alcohol consumption that increases the risk of certain cancers, and those are the cancers that you see here. So I also want to give some examples of foods you should eat and increase more in your diet. But also consider whether you have sensitivities or allergies or risk for certain diseases. You have to consider that too. It's good to talk to your doctor when you are looking at certain dietary needs based on your health status. So I just want to talk about, to mention that soybeans have complete proteins, right? It has, dietary fiber, it has vitamins, it has omega-3 fatty acids, very nutrient dense. Spinach builds energy, bones, and muscle. Oatmeal provides your body with sustained energy and good fiber. Eggplant is good before a workout. There have been studies on apples, maybe not this graphic apple, but on a real apple. Studies have shown apples to be a pick-me-up in the morning, a good substitute for coffee if you're trying to get off coffee. So that's something to think about. Low energy foods, like all your fast food restaurants, foods, they weaken you instead of giving you strength, right? They increase our risk of clogged arteries and lead to heart issues. So we have to bear that in mind as well. Some herbs here that I think is important. Turmeric has increased in popularity over the past few years. It is a natural antiseptic and antibacterial agent, useful in disinfecting cuts and burns. It's an anti-inflammatory, but we have to realize that excessive use of turmeric should be avoided. Like anything, excess is not good. Yes, that's the temperate part of our 8 laws of health, because it can interfere with medications that you're taking, rendering your medication ineffective. And too much for too long can cause stomach distress. So those are things to be aware of. Garlic has high antioxidant. It's claimed to prevent heart disease and cancer and high blood pressure. And then you have onions. Onions are good for colds and known to help with heart disease, prevent heart disease as well. It's an anti-inflammatory and anti-cholesterol. So I wanted to just mention those. And skipping to physical activity, we're still in primary prevention. Physical activity is beyond looking good or looking fit. It's really, it does so much for our bodies. It reduces the risk of several types of cancer, and it lowers the risk of heart disease and high blood pressure and diabetes and osteoporosis, and prevents weight and obesity, and again, a risk of developing cancer. And I said that already, but I tend to harp on cancer because one of the things that I don't know if you saw when you researched my bio, I was at the National Cancer Institute for 16 years with the federal government. So much of my work in the last 16 years have been on cancer prevention and control. So I tend to lean more into talking about cancer when I do my health presentations, or especially with health disparities. So physical activity improves quality of life, even among cancer patients and cancer survivors. It's very important prevention. And in this case, with people who are patients already, it just improves the way they feel. And the last primary prevention I want to mention is the tobacco use. Let's hope no one here smokes, because more than 60 million Americans are living with a disease caused by smoking. Tobacco smoke causes at least 30% of all cancer deaths. Smoking causes 500,000 deaths per year. And out of that number, 41,000 is from secondhand smoke. So it's not just, oh, I don't smoke, but around others who smoke or use pipe cigars or any of those things, it affects us as well.
What about all this marijuana, all the stores that are opening up for people to buy the marijuana?
Yeah, there are various research on marijuana and health, but because the research is not consistent, there's not like a big anti-marijuana campaign. They're more focused on that it's sort of a pain, it reduces pain, especially for those who have chronic illness like cancer. The research is yet to be seen. Like you said, this is all new, right? New laws with all these dispensary all around. So it's yet to be seen after a while, looking at the research to see exactly what we're doing to ourselves.
And so many of the stores are opening up in our neighborhoods too.
Yeah.
Mhm.
Yeah. Secondary prevention, as I mentioned before, it's early detection of a disease. You want to slow it down or you want to stop it. And, after you've done your best to prevent, disease, it doesn't mean that it's always going to happen, right? Because of the environment in which we live. So you want to check to see, is there something though? Because if there is something, then wouldn't you want to make sure that you find it and catch it before you have, you worsen it or before you have premature death? You want to make sure that you want to identify if there is something wrong so you can fix it early. The whole point of screening is early detection, to make sure you find things early to stop it or reduce it. And the age of screening varies for all of these right here. So it's good to check with your doctor to see if it fits with your age and if it fits with your health status, like what you should, are you at average risk or are you a high risk person for a disease, and how early you should get screened. And I do want to mention, I don't know if folks know that the screening recommendations, why your doctor says, hey, at this age, at 50, you need to be screened for colorectal. Like, where is your doctor getting this information? He's not in the lab doing the research, or majority of doctors aren't. But where they're getting it from a task force called the U.S. Preventive Services Task Force. They're an independent panel of nationally recognized experts across the nation in prevention, evidence-based medicine, in science. Many of them are, physicians, family practice pediatrician. Others are scientists, some are nurses. They're not federal employees. They don't work for the federal government, but they have to report to Congress annually all the recommendations that they have produced. And every 4 years, there's a new panel. So it's not like, oh, these people have vested interest and they want money, and so they're going to say this is what you need to do. It rotates different people every 4 years using the best available evidence of how and why we should screen. So don't be surprised that what you were told in the 80s or the 90s, like, this is the age you need to screen, it's not the same today. Because things, they look at the best evidence and they realize, okay, this is no longer true based on new research. And, and I have here breast and colorectal because these are two new recommendations that are about to come out, right? It used to be screen mammography once a year at age 50. And then it went to, okay, you can start at age 40. Every other year. So it's every other year now, but they may be changing the age. And one of the reasons why there are so many changes happening now is the task force is now looking at those social determinants of health that I mentioned earlier. It's getting more attention that there are certain populations that need to be screened earlier because of their circumstance, because of systemic racism, because of their limited access and opportunities that they didn't have compared to other races. So they need to be screened earlier because this disease is happening too quickly. And an example is Chadwick Boseman. You guys know Black Panther, right? he was diagnosed early with colorectal when the colorectal cancer screening age is 50, right? That's what it's 50. The new screening recommendation, I know that one that's going to come out is going to change to 45 for the general population, all races. But they, for the Black race, it may be 40, maybe different than everybody else because we're getting colorectal cancer earlier than other folks. So those are the things that it's good to talk to your doctor and see that, make sure they're using current recommendations, not recommendations from 10 years ago or 20 years ago. So just wanted to highlight that here. Moving on to tertiary prevention, moving towards the end. It's all about disease management. You want to be compliant. You want to take your medicine so you don't worsen a disease that you have or an illness that you have. And you don't want to take someone else's medication because you ran out. You be mindful of that. You don't want to do that either. You want to adhere to proper treatment regimen to reduce the effects of your disease or the symptoms from your disease. And that includes taking your medicine on time. And also, that many times disease management include new start. Many times when someone has an illness or a disease and they're taking medicines, their doctor may say, you also need to change your diet. You also need to add exercise, all these things. And then we know enough water, sunlight, all these things are good to help with your disease management and communicating with your doctor. Studies have shown, especially with the Black community, we don't communicate like we should. And some of it is distrust and mistrust, right? That's for historic reasons. But, it's your health. So it's important to make sure that you communicate. If before your appointment, if you have to make a list of your needs and your questions, it's good to do that. And you want to tell your doctor what you eat, what you take, so that there's no interaction. Some herbs do interact with medicine, making your medicines not effective. So it's good to communicate that to your doctor. And I like what Ellen G. White said in Health and E-Healing about disease management. She says it doesn't matter how skilled a physician is, her expertise or brilliance. After she cures or heals the patient has to make the changes to prevent the illness from reoccurring or to be able to adhere to the management of the disease. So that's very important here. And so, with all this information that I've given you, if you want to find information on your own, like how do I access, some of this information? There are good health messages and resources out there. And I think a first step is to start with your church ministry leader. Someone in this role is connected to conference materials, should be able to provide some of that, and even provide some books like Ministry of Healing or recommend some books. And so, speak to your church ministry leader who should have some kind of expertise and knowledge in health to share with you resources. There's the health departments, they have information, nonprofit agencies. I just want to make a warning. I was talking about this earlier with Cindy. Don't believe everything you see on the internet and on social media. There's a lot of misinformation and disinformation. And disinformation is when people purposely spread false information. For what reason, we don't know. Some of it may be political, other reason, but there's a lot of stuff out there that's not right. I have CDC and NIH here. The government has lost some credibility, not going to deny it, especially during COVID. And a lot of it is due to politics. But researchers, I've been at NIH for 19 years, 18 and a half years. Researchers are everyday people like you, like me. We're doing our work. No one is breathing down our shoulders to try to do stuff to the public, saying that we have to make things according to what we think people want to hear. We're really doing our research and doing our work and producing these statistics. So I would say anything that's .gov is also credible information if you're looking for correct information. And just to summarize everything that I have said, since I started with defining health disparities and health equity, I will end with, in our Black communities, many residents did not have or do not have the opportunity to a quality education, a high-paying job, quality health insurance, decent housing, or family support. So, and much of it is due to systemic and structural racism. So if you're able and you have love for your people, you should help to improve health, try to help to improve health in your communities, but doing so by addressing their basic needs, right? That's what we need to do. We need to also advocate for changes in the community, if you're able, a safer environment, affordable housing, walkable areas. Leverage the expertise in your church, in your community. There's a lot of folks in your church that have that's very knowledgeable when it comes to health, and you want to leverage them and empower the community. Ministry of Healing says, Christ gave the church the duty to care for the sick and the poor. That is our personal responsibility. We must minister to those who are sick, as well as those who lack knowledge about living a healthy life and about Christ. And the last thing here is consider our lifestyle and incorporate those primary, secondary, and tertiary prevention to reduce disease, illness, or injury. And I leave you with these last two scriptures. They're potent scriptures to me. 2 Corinthians 7:1 says, let us cleanse ourselves from everything that can defile our body or spirit, and let us work toward complete holiness because we fear God. Proverbs 24:5 says, a wise man is strong. Yes, a man of knowledge increases strength. So it's my hope that I was able to impart some knowledge to you today, something maybe that you learned today that you didn't know before, and that will contribute to improving your strength. So thank you.
Thank you, Dr. Laurie. I just wanted to ask if anyone had any questions for you. Anyone with questions?
I have a question, and it might be just a bit different as far as the subject is concerned, but what is your opinion on the church's position when it comes to vaccinations? Should the church speak about vaccinations, the advantages and the disadvantages, or is that something that the church should not be involved in your opinion?
Oh, that's a very good question. And of course, you're asking me from my personal opinion. I don't think the church should speak against vaccination because it has its place, but if it's, the church can also have the option of not saying anything. If there is an issue and there are folks in the church that have their opinions on it, and it is controversial, perhaps the church should not speak either way. That's what I would say. But in my personal opinion, it's very important to be vaccinated. There've been so many infectious diseases all the way back, way back from 1300s, go all the way back, smallpox and different viruses, and COVID has been around way before now. In the 40s, they saw COVID, but it wasn't at this level. So God has given us the knowledge, given man the knowledge to be able to develop something to prevent harm and from hurting us. I don't see, why we are so against it. A majority of us have been vaccinated since we were kids, from polio, hepatitis. There's so many vaccinations that we've taken since we've been children or infants, and those diseases are very rare today because of vaccination. That's why folks, I've heard this from younger generation. saying, well, why are we, these diseases are no longer here. Why we need to be vaccinated? Well, the reason why these diseases are not here is because we are vaccinated. But they weren't around to see when there was all these public health emergencies and these diseases were harming us. They weren't around to see that. And that's why a majority of them, that was a big step in public health is vaccines. And that's my opinion.
Mhm.
Okay, thank you.
Thank you. Thank you. Any other questions? No? Quiet group tonight.
Okay, well, thank you. Thank you so much, Dr. Antoinette, for joining us this evening. Your information is so important and so true. Some of us online have worked with inner city children in inner city schools. And I can tell you that in many cases, if not in most cases, the diet is horrendous. It's basically junk food that they're eating. And if you get into the homes, you see that's what the parents are serving, the same thing. But years ago, some of us who are over 39 used to have dinner with our families. They call you 5 o'clock, 6 o'clock, whatever the assigned time was, and you would sit down and there would be some good food, some vegetables and healthy things that you were supposed to eat. And if you didn't eat them, there would be no dessert. But family situations have kind of changed now. So diet is extremely important. And also many of the inner city teachers, same thing. Their diet is stressed out and their diet is not good. Another thing that you mentioned that I see is a problem is exercise. We would have some maybe 5'7" freshmen coming into our building, 5'7", 125 pounds. By the time they were seniors, 5'11", 200 pounds. And it all has to do with diet. Diet really isn't good. So your message is really apropos. So thank you so much for joining us. We
Thank you.
appreciate your wisdom and your knowledge.
Thank you for having me.
Okay.
Yes.
So we're going to take a few more minutes. We're going to do our